Good afternoon or good evening, everybody. The days are blurring into each other. I have to think of what time, what day, what season. But good evening. I'm Dr. Gigi of the Rodham Institute. I'd like to welcome you to this wonderful session that is going to be about aging and metabolism. Thank you for joining us. And as we are coming into the season of holidays, I hope that everybody's staying safe and healthy. Before we get into the topic at hand, and I introduce the two wonderful speakers that we are so honored to have with us tonight, I just want to kind of review some things relating to COVID-19. COVID-19, as you know, has just continued to ravage our communities, and there's been a disproportionate price that Black and Brown communities have paid. As a matter of fact, here in the nation's capital, 84% of all deaths have happened among African Americans, and there are about 46% of the population is represented by African Americans. So that is close to double the number of actual people of the population. It is important that, especially as we move into the holidays, which may mean spending time with family and loved ones, that we continue to be vigilant. I know I'm tired of the masks. I get it. It's not easy, but when I'm thinking about my 86-year-old dad and my 79-year-old mom, wearing masks is the gift of love that I give. And so if we lead with love rather than thinking all these rules that we have to follow, physical distancing, washing hands, and wearing a mask is what I would recommend, because we're tired of being kind of lectured to, and we're tired, right? That's not something that anybody can deny, and it's taking, I think, a toll, especially as we move into the winter months. This has been a rough year for all kinds of reasons, not just the COVID-19 pandemic, but the pandemic of racism and the serial murders that have happened all across the country. And all these things are tied to each other, and they impact the health and well-being of Chocolate City and the residents of Chocolate City. So if you are interested in getting information about the upcoming vaccines that are now being released, first to frontline clinicians, and not even everybody. So for example, in our own hospital, it's the ICU and the emergency department that's getting the priority, and then the rest of the hospital, and then those of us that work in the outpatient setting. And then of course, people with chronic medical conditions that are high risk from dying from COVID, and then everybody else. There's a lot of information, a lot of myths that are out there about the vaccines, but we want you to make an informed decision. So please join us. We are part of the Black Coalition Against COVID. You can visit the website, the Black Coalition Against COVID. We've got several town halls coming up. And if you've missed any of the town halls, you can actually just go ahead and look. They've got all the town halls archived. The thing that's great about this coalition, that it includes the 4 historically Black medical schools are part of this. So our labor and education and business and really every facet, of course, the healthcare, the clinicians of color, African American primarily. So I would really urge you to go and find out if this vaccine makes sense for you and your family. I personally am going to take it because I'm a clinician, but as some of you know, I just had a bout with kidney cancer. So I am at that high risk group. So, and then, in terms of how COVID is hitting our city, people are really suffering, and we're very concerned about all of the upcoming evictions that are going to happen in January. Of course, you've heard that our mayor has given $1,200 per person that needs it because the stimulus packet has not passed through Congress yet. I will tell you that people can't find enough to eat. So if you're going to do anything, think about the food, because our seniors, our children, our teachers, people all over the city. And by the way, when it comes to seniors, just let me tell you, There's a myth about senior food insecurity, that it's just with poor seniors. That's not true. In the richer wards, something like 10% of seniors actually suffer from food insecurity. So be a good neighbor, be a good citizen. Think about donating food or coats, something that can help community members who are always in need, but this year is really an exception in a bad way. So just let's stick together. We're going to get through this. I know we are. So without further ado, and of course you could always make a donation to Rodham Institute, because we're helping to bring not only these programs, but actually feeding people, as well as bringing masks and pulling together these educational initiatives, including the Black Coalition Against COVID. We're also a partner with the blackdoctor.org that's actually going to start partnering with us as part of the Rodham Institute's Impact Speaker Series. Okay, so let's get started, and let me introduce our fine guests. I'm just going to talk a little bit about them, because I will introduce them and their titles, and then they can tell you more about themselves. And this is in alphabetical order. Dr. Lodhi is actually a colleague and an assistant professor at GW. Her specialty is geriatric medicine. And of course, we really appreciate what she's going to be sharing with us about how the body changes. Of course, those of us that are above a certain age know that our body has changed and our metabolism has changed, but we'll learn more from her. And then we are excited to have Ms. Percita Moore, all the way from Los Angeles. And she is an acclaimed health, wellness, and fitness guru champion. And she is the founder of Bodies by Percita. So let's start off with you, Ms. Moore. Tell us about yourself and tell us how you got into this field in the first place. And welcome.
Well, let me unmute myself. Well, thank you so much for having me. It's always a pleasure. I basically began my journey in fitness in my early 20s. I'd been an executive vice president for a few digital media companies and had worked entertainment primarily most of my life, and got into fitness due to the fact that after my second child, I didn't want to travel as much. The irony of 15 years of doing that, and then the last 7 actually working within the geriatric arena, fell into my lap. I was taking more of classes, I should say, with some clients who were diabetic. And they asked me to basically take on the initiative of being their caregiver, because they did not have a loved one that was willing to go with them. And within that, I was asked to then teach some classes for some of the doctors. From there, it actually turned into me creating a entire department for, at the time, a little over 1,500 seniors that turned into close to 5,000. And I built that from the ground up, simply looking at the need of what was there for the seniors and their camaraderie, and trying to get them more acclimated to the change and loving on themselves again. So it's a very interesting scenario to think all this time in the industry and coming into it thinking it would be more self-induced, right? And really making sure myself and my younger clients would be in shape, really turned into something that was more of a compassionate ride with my 65 and older. Actually, some scooted in at 60 for some of the senior programs, because there's just a need to understand what the mind goes through. We talk a lot about what the body goes through, but it's really, for me, more of what the mind goes through, and your disconnect with having this ability of feeling as if you're wanted and needed. So for me, it's always going to be for, that community, right? That branch of people, because we say senior, and that can be several things to different people, several different baselines, several different angles. I would say it just became something that was just something heartfelt. I have an 82-year-old mother who lives alone and lives well, but I'm still seeing, even with all of the T's crossed and the I's dotted, a lot of struggle that she goes through. So it's really more of a compassionate crusade, I'd like to say, for myself. And I've enjoyed it immensely.
Wow. Well, thank you for sharing, because I think when, we're listening to presentations, I think that the backstory is incredibly important to learn about the motivation of why people are involved, because people look at titles, but titles really don't tell you anything about the person, and certainly not about their intent and motivation. So thank you for sharing that. Dr. Lodhi, tell us about your work and sort of what motivates you. What do you do?
So thank you so much, Dr. Opayumi. As you know, I work across everywhere where our older adults are, from inpatient to outpatient to subacute rehab and long-term care, as well as palliative care in the hospice now. So really, my motivation, I was raised by grandmothers on both sides of my family. But then when I was a resident, and I started working in this geriatric long-term care facility with my geriatrician, she really motivated me. And I realized I connected more and it made more sense to me. Especially as, as our bodies age, we know some of the things that are happening. Our kidney functions, for example, declining as a function of aging itself. So to me, that was fascinating because since medical school, we are all trained to do something about it. And what I learned in geriatrics was it was more important to not do something and just stand there and listen. So, that's a big part of what I do and what motivates me every day from my patients who are now my extended family, I feel like, in different areas, especially with COVID, like you said, among the other challenges of, what to eat and how to get food to all our seniors, for which I want to commend our city. For my patients, I feel like the city has done a great job. But at the same time, while I appreciate my patients being having foods delivered to their homes and to their apartments in long-term care facilities, at the same time, that poses another risk. They are isolated now. Now nobody is observing how much they're eating and, how well they're eating. So I'm seeing a lot of weight loss in addition to isolation. And the reason is just because they feel so lonely. They don't have the pleasure of eating together anymore. So there are so many aspects of motivation for me from my patients every single day, and what we could potentially do so much better for them. So that's what I do, and that's what I enjoy every day.
I'd like to ask you, Ms. Percita, how do your older adults and your older clients, what is different? I mean, take us through some of the physical and emotional challenges, or or not challenges, but just differences between younger and older folks in the work that you do.
I think it poses the initial question of how much of societal intake are you going to believe, right? You're told instantaneously that at a certain age your metabolism slows, but what's never spoken is that it has no valid or a validity in anything more than you're just getting older. It's spoken as if you're not doing something to speed it up or slow it down. It has nothing to do with that whatsoever. If you are looking at a 55-year-old runner, against a 65-year-old runner, they're both running at the exact same pace, at the exact same, regime of what they're doing. And regardless, the metabolisms are going to slow. So when you get the senior population, and when I say senior, even an active person, because we're still talking about different baselines, but I would say the active senior is still proposed with all of these things that they should not be able to do based on what society has told them that they can't. So it's the first mental game of getting into their mind to allow them to understand, hey, you can actually do whatever you want to do. You don't have to be in fear of hurting yourself or not really having the strength to do it. It's all in baseline. It's all in understanding where you are and working to the greatest capacity you possibly can. So what I've noticed more with seniors is that a lot of them have been told, even with their diagnoses, that there's no way to change it. So the mentality becomes, then why really am I doing the work if there's no way to really change anything that's going on? And I think that's just hard pressed for when a person's being diagnosed to understand those words play a huge role in them. And then they don't say anything, anymore. So even if they are aching, and I'll say, well, why didn't you tell your doctor how you're feeling? Well, I don't want to hear, what it is that they're going to say, because it always becomes like yet another pill I have to take, or another this, instead of actually leaning into another part of their, lifestyle, or their sleep, or, just how they're intaking life itself. So I love when the doctor just spoke on even food being delivered. The food delivery services, food as a whole, because it's frozen, is a horrible process to even give a senior, technically. So even that becomes, how hard is it for me to find ways to get them fresh things against what is economically sound within the frozen things, right? In order for them to even be able to sustain their activity, and they're full of salt. And it's almost like this cycle that they're trying to get healthy, and they're trying to be with me, and they're trying to be as active as possible. But when they go and get their labs done, it completely feels as if they're working against themselves. So I think for seniors, it's really, what am I doing wrong, right? Why is it that nothing seems to work? Because whenever I'm feeling great, the doctor says my labs are bad. And, so it's like you can't win for losing. And I think that's really the hardest part.
So I'll just say sort of a mea culpa. I think in general, the relationships between not all doctors and patients, but we tend to be more like lecturing and kind of blaming the patient, when we know that 80% of all health outcomes are actually related to structural and social determinants of health. So for example, and I'll just digress for just a quick second, the Rodham Institute started this program called See the City That You Serve about, it would have been our 6th year, where all the incoming interns actually go to and see the city, so that when they are recommending something to somebody, like you need to go to a gym, or you need to go, get fresh fruits and vegetables, and there's only one grocery store that serves 80,000 people, that there has to be that reality check. But in addition to that, I think that it is about leading with your heart and not being punitive and not lecturing. And I think, as you've mentioned, and I'd love to get your thoughts on this, Dr. Lodhi, because we're of bicultural backgrounds, and in sort of white mainstream society, American society right now, unless you're a rich white man, which is another category, older folks are really kind of, they're just not necessarily incorporated. Whereas the three of us come from cultural backgrounds where actually older people are revered, are seen as a source of wisdom and knowledge. And, that's sort of our valued folks, our children and the elderly. Those are the people that are really the jewels of our families. So Dr. Lodhi, tell us more, please speak to us more about that aspect of the, when people it's not only the social isolation, which of course everybody's experiencing, but particularly seniors, but when people don't feel valued, or what does that do to the physical health? What does it do to the mental health as well?
Absolutely. And, it's so sad to see. I think part of it is everybody wants to be included, even if you, from our backgrounds, that even if we make our decisions, the way we put it to our grandmothers or mothers is they feel like they are making it for us. They are wanted and they are needed. I think that's the feeling that I can see the difference in. For example, I'll tell you, 2 years ago, my grandmother came to live with me. So it was my grandmother, my mother, myself, and my children in my house. Wow. And, it was 4 generations living under the same roof. It was a whole different experience. And I saw the changes in my children as a result of that experience. My son was 4 years old. And as soon as my grandmother would come out of the bathroom, he would shout to everybody, BBG's out. And, he ran to get her. And now I can see it in my patient spaces around the holiday season, when the families are coming to visit and when they are waiting for the grandchildren or great-grandchildren to visit. I am very lenient. As you know, with age in and of itself, our diabetes goals change. We are not strict about maintaining that A1C of 7. And around holidays particularly, I am not going to tell my patients not to have the piece of cake with their children or pie or, whatever brings quality of life and joy to them. And that is so important. And I see that missing. You're absolutely right. Unfortunately, in our mainstream so much. I see it in my neighbors. I see it in my patients. And one of the things that, as a geriatric division that we've done is incorporate more medical students to get in touch with our older adults. I'm actually proud of this. One thing that we did was take the medicine out of classroom, especially the geriatric part, and to the patients. And when I joined as faculty, I was working for found these assisted living facilities. And you know how they started as the hotel for the elderly. But what they are really, the people who started living there in 70s, they are now in their 90s and above, more than 100. And they hadn't seen a physician in so many years. There were this list of 13 medications that nobody had looked at. So when I took the students there, not only did the students have a different, side of medicine that they saw, but my patients just light up. When I assign medical students to see my patients, just follow them longitudinally over the year. They are looking forward to that visit every month.
Well, that's a very good point. I think that the fragmentation of the society, it's not just about the elderly, it's about what we also lose on the other side.
Right.
So Ms. Percita, please talk to us about, just take us through. You have a new client, and what do you do, and to begin to assess their goals and their what would work for them? Can you help us visualize that?
Absolutely. The first thing for me with all clients is to actually get in your head. If I can get you to believe in me, then I know that I have you and you're going to succeed. If you do not agree with what my tactics are, how I think, I'm really more of a spiritual person first. So I really want to find out, like, what is your decompression like? How do you manage stress? What exactly are your intakes and outtakes on society as a whole? Are you opinionated? Are you not? Like those types of things. So when I'm talking to seniors, I really want to know, what's the relationship if you have kids? If you didn't have kids, why didn't you have kids? Why didn't you get married? Seems a little intrusive, little TMI, but it's all for the reason of when they speak, I want them to understand that I'm not trying to figure out what the statement is. I'm actually getting a blueprint on how they move and they execute. From there, it becomes a position of showing them what they can do, more so than teaching them anything. It's like really them teaching themselves to understand, I don't really need Percita, right? I actually have all of these abilities within myself. So my first approach is always, you really have everything you need to be successful. And once you understand that and you look at a problem and you believe the problem can be solved, sky's the limit. We go through life looking at problems and we believe that the problem can't be solved. And it causes us so much pain and anguish, we forget that. So I like to bring up things and hear stories of how they moved and what they did and what didn't work and who they dated and stuff like that, to understand where they're going with it. I like to talk about food and say, half of the people that you'll go and see in the hospital aren't quite as healthy as they should be. Should tell you a little bit about knowledge does not necessarily mean you execute. So it's those little things that can kind of take the pressure off of a person, especially in their senior years, feeling as if they have to give up. I'm like, you're still alive. You
Mhm.
woke up in a space where sky's the limit. Only deal with the day. Don't worry about the future. You've lived, that's my favorite line. You've lived long enough that you don't have to worry about anything. You can literally just wake up and say, have no clue what I'm doing and be fine with it, along with just them knowing that I enjoy talking to them or I look forward to being there with them. Once those I's and T's are dotted and crossed, I literally have clients that have lost lots of weight, 100, 200 pounds. And these are young and old. And I think the whole reason why I can't get rid of them is not because they haven't reached their goal. It's like we become compadres. We actually become constituents. We become, all of those things. We believe in the same things and we don't always believe in the same things, but we have a common decency of integrity of knowing what that is. And that's just an everyday take, because I really believe that that's what's missing in society, this place of allowing people to be without you really understanding what the be is. You just allow them to be as you allow yourself. And
Well,
then everything's perfect.
that philosophy, you said, given what you do, but really that's also the philosophy of a physician as well. I mean, I know how Dr. Lodhi practices, how I practice. It is, first and foremost, does the individual trust you to sort of bare their souls, if you will, about why they're not following your advice? Or why, and I love it when patients, when I say something and I'll say, what do you think, they're like, no. I'm like, okay. And I feel good because that means that they feel comfortable enough to say, no, I disagree. But so being in that space first, instead of just saying, oh, your glucose is X, I'm going to give you that prescription. So Dr. Lodhi, I mean, please talk to us about why is it that lifestyle and not just prescribing another medication is important for everybody, but particularly for seniors?
I think it's because we forget sometimes when we think about, we are not the decision maker. It's a joint decision making team with the doctor and the patient. When you know this, when we are teaching our medical students in the first and second years, we are telling them we can sit there and write whatever prescriptions we want to, but if your patient is not following it, it's not going to make any difference for any of us. To your point about when your patients feel comfortable, what we need to do is sit down, explain to our patients, why we are recommending some things. If I'm asking you to, this is the kind of diet that I'm recommending, what do you think about it? We would probably have a better response than say, okay, this is what I want you to do. Sometimes we do. Sometimes we have to do that. When we know our patients, it's the motivation, we have to get them there. But most of the times, what I think we need to do, and where I have been very successful, has been when we were a joint decision-making team. When I explained to my patients better about why I was recommending something and why I think it would be helpful, and then not be, I don't expect on the very next day to things change. They have a life, they have a quality of life, and I should be able to probe further when my advice or whatever is not being followed. What's the reason behind it? And listening to my patient's side of the story is very important.
Well, let's talk about that, because when it comes to food, especially in obesity, which I hate that word, being heavy, especially in certain communities, people forget that there is a link with sexual trauma when you're younger, as a child or as a young woman. When with all the things that have happened in the last, whatever it is, 9 months now, and really the PTSD, the post-traumatic slave disorder, that's seeing, over the weekend, there were 2 churches that in DC that were vandalized, historically African-American historic churches. And just the anxieties that has been, there. I can tell you that, thinking about going back to work for me after being off for some time, I had not binge ate this is true confessions now, in months. And then the other day I found myself I couldn't get full. And it was really about the anxiety. So Ms. Percita, I'm sorry, do you recommend a specific diet or what because there's so many fads out there, right? People talk about keto diet. Actually, one of my patients ended up in the hospital because she was following a keto diet and she has diabetes. Actually, she's a young woman and needs insulin. But so Dr. Lodhi alluded to this, is that, perfect is the enemy of the good and being rigid is not helpful. But are there some things that work better than others?
Well, there's got to be a parameter. I think what most don't understand is that people who are literally trying to lose weight only talk to other people who are trying to lose weight. It's the funniest thing. No one actually speaks to a professional. And that tells you a lot about what the intent of that person is at that time. They're not really ready to make a change. Change is difficult, no matter how big or how small. So I don't believe in dieting. I believe in really having a connection within yourself of purpose and of truth. I have a slogan where I say, live life authentic. And what that basically means is you have to know when you're in that anxiety space and how food plays a role to feel full, right? Because it really was never going to happen until you just own the fact, look, I don't really want to go back to work. It's just what it is. It has nothing to do with I even want this. I just don't want to go back to work, right? So when you can stop and identify that honesty within yourself, you don't really need a diet. We hear a lot about DASH diet and, the doctor tells you, where your sodium should be. But I always feel like that's such a blanket statement to put amongst everyone when the medical field understands that there's baselines for everything else. So why do they not understand that there also have to be a baseline individually for people's intake? Like you're talking culturally, Black people are absolutely thought-driven people. You can't say to a Black person, well, that's going to kill you, when my grandmother is 106. It's kind of complicated for you to pull that off. But in the same breath, we don't identify the fact that a lot of what you just said, being the trauma that the Black race has gone through, is really what has genetically, quote unquote, given us this disposition, because we stay stressed, right? There's never a day that you're not stressed. So what if you ate perfectly? I mean, there's plenty of people who've been noted who eat well, body fat is fantastic. They're in the gym 5-6 times a week and they're dead as a dodo. So you have to then be realistic to understand it's got to be more, right, than just the food intake. You have to really pay attention to yourself. What is working, what is not working for you, instead of just saying, I'm just going to blanket statement it. I like to tell my clients, we start off with all of what they're eating. So instead of me telling them what to eat, I want to know what you're eating on any given week. Write it down. Let's see. And then I want you to pay attention the next week on how you feel after you eat everything that you wrote down. And why did you eat it? I have gotten, for 22 plus years, more results that way than ever blanketing a statement and say, you need 40 grams of protein or 30 grams of this. Most of my clients think I'm psychic. It has nothing to do with that. It's just the premise of listening. What's your lifestyle? When do you wake up? When do you go to sleep? You do not need 3 gallons of water. The reason why that comes out is because bodybuilding has a lot of supplements and it has a lot of steroid. So those people, that community, has to drink a lot of water in order to replace. But if you would think, well, we're 80% water, why would I need more water to be water? Then, it starts to make more sense to you, where you go, okay, well, maybe I can listen to my doctor. Maybe they have something to say, but it is hard when you're dealing with the medical profession, and a lot of the medical profession is not as healthy as they should be aesthetically. That's what's tricky, because then you start saying, well, what's health? Is it this skinny, person, or is it? So if you catch what I'm saying, it's like, it's no particular baseline you can use. And I think that it would help the community of geriatric and seniors, even some youth, if some doctors just simply said, like, hey, I'm Indian. This is healthy for my culture. We are not into da 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 da.
Right.
Instead of not saying that, and then they're walking out going,
Mhm.
I don't get that. You know what I mean? Like, how does that work? I literally had a nurse who was like, Percita, you have high blood pressure. I'm like, I'm sorry. It's like, I get anxiety every time you take my blood pressure. And she's like, no, 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 that's impossible. I'm like, I get anxiety every time you strap me down. I'm absolutely paranoid, right? Well, it turns out I was on the cusp, but at the same time, what I was saying was real. And she's like, well, I don't understand. What would you be stressed about? I'm like, I'm a Black
Coming
woman.
here.
I mean, like, I'm just in the building. I'm just completely stressed out. And she goes, oh, well, you know, mind you, she was probably over 200 pounds. I mean, on a good day. But if you catch it, it was hard for me to even listen to that because I didn't feel as if she paid any attention to what I said, nor did I think that she cared about her own self. You know what I mean? So it's always interesting to me on how that works out because the doctor is on point when she's saying everything she's saying about how she's more into quality of life.
Yes.
If we get everyone on board of understanding that,
Yes. Yeah.
I
Well,
think we win.
thank you. Thank you for sharing that. Dr. Lodhi, let's talk a little bit about movement in older adults and the importance. Obviously, through this conversation and your philosophies, we're not going to tell anybody, it's not just about age, to go run a marathon, to keep, to exercise. That's not going to be a reasonable goal for the majority of people. But talk to us about what makes sense. What are sort of some reasonable, we'll call them guidelines or suggestions that you have found as an individual, a physician, but also what the research has showed in terms of movement playing a role in both health, well-being, and psychological well-being?
Right. So as you know, the evidence base, if you will, is um, any exercise, aerobic exercise, 30 minutes a day, 5 days a week. Having said that, a lot of my patients, like you said, are nowhere near that. So it's the same geriatric mantra that we use across the board: start low and go slow. So I tell my patients, first of all, like Ms. Percita was saying, we have to get to know our patient and try to see what their baseline is. So that first visit we have with our patients is very important. Or maybe sometimes it takes 3 visits to sort of establish the baseline where we are. And setting short-term and long-term goals. So if my patient is hardly making it to the bathroom, I'm not going to ask them to start walking 30 minutes a day. What I'm going to work with them is, okay, can we walk in the hallway? Start with 5 minutes a day and make it a routine. Once I'm there, then incrementally increase it, with my goal being that I'm going to get them to at least 30 minutes a day of physical therapy or physical activity. And it could be something as simple as walking on a plain level surface for, my goal is for 30 minutes a day, but it could be anywhere just above their baseline. And then it also matters, what their comorbidities are. If this is a patient with arthritis, her pain is so much that it's really limiting her getting out of the bed, then my job as a physician is to back up, control her pain better, and start with something simple as a Tylenol. And just, again, depending on the comorbidities, I don't want to knock out their kidneys with a medication that would be digested to the kidney. So controlling pain, understanding the comorbidity, getting your patient's baseline functional status, and then slowly going up on it is the way to go as far as physical activity is concerned. The other thing to also consider is, does my patient, I have a lot of patients who don't have a safe place to walk outside of their houses. What do I tell them? It used to be, is there a mall close to you? Because I know a lot of my patients went to the malls. With COVID-19, even that's not an option.
Right.
And how about day programs? They were a wonderful, resource for me. Now I don't have that. What do I tell my patients? So it's really tricky. Is there a park close to you? That's my thing. And now they're saying, okay, what time do I go to the park? What would be a safe time to go out? And what would be, who would go with me? Do they have to take a walker with them? Do they, who would, is there, the park is close enough they can walk there? Not most of the time. So there are multiple challenges, and we have to know our patients to say what to recommend.
Right.
If
Yes,
I
Ms.
could chime
Percita.
in,
Yes.
I would say that there's so much for a senior to do at home. It's actually ridiculous if you really think about it.
Tell us.
So, I mean, someone in an arthritic situation, I'd simply tell them to lay on their backs and lift their legs up in the air. You'd be amazed at how much cardio that takes. It is not necessarily the legs that necessarily are identified as moving. It's really more when you're saying 30 minutes of movement. I always wanted to explain to physicians that it has nothing to do with your legs. You know, you can do so many more things. Something as simple as lifting a glass up and off of the table, moving it side to side, actually taking some peas or some carrots and curling them while they're sitting in the chair and lifting them over their heads is going to give them the cardiovascular that's needed. I've heard 20, 30 minutes. I would tell you to take it in the 5-minute intervals throughout the day. Does not have to be all in one sitting. And it does not have to be something that restricts them. Again, with one's baseline is identified, there's push-ups and, squats, just getting up and out of the chair, coming halfway up and halfway down. I mean, I literally am running home workouts at this point because gyms are so not able to be consistent in regards to being open. And these are for able-bodied people. And they're only capable of working out at home with no gym equipment whatsoever. So it's one of these things that I just think some physicians just need to be aware of other things instead of just saying to get up and walk. I had a beautiful conversation with somebody about that. Like, oh, well, the Surgeon General says you need to walk, 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 walk. You can walk through your home, absolutely, but you don't know how your heart rate is doing unless you're in a position where you use what I call a speak tactic. And what it is you simply want to be in a place where you're breathing that way. That means your heart rate is at a level that it's actually working. It can be anything. It could be prepping your food, to be perfectly honest. If the containers are up and down and you have to reach up and reach down, you'd be amazed at how much activity it is. Those are the things that I am pushing the physicians that I know to pass on to their patients instead of simply saying the general stuff, which we've been saying for years, right? I mean, walking up the mall, things like that, they aren't bad things, but we have to change with the time. I like to call them facts, but they're old facts now. We need new facts. And the new facts is, I have a client who moves her furniture around every week. It is the funniest thing. She will take a chair and she will move it to one side of the room, and then she'll take another object and move it to the next side of the room. So her house looks crazy. But she's like, who's coming over? It doesn't matter, right? I'm getting my exercise in. And I thought, what a great way to think of ways to do things. And that's what I mean by saying, am I doing it right? Am I doing it wrong? If you eliminate out the aspect of only walking, right? I'm not saying not to walk. I'm just saying that can just be an alternative, but give them a plethora of other things that they can do. I think you're going to win with them actually moving, just to be like, okay.
Yeah, well, you speak to something that from a physician standpoint, I think is very important to acknowledge. It's like we are being asked to do so much without necessarily the training for it, right? Now, because of the way that mental health is viewed by insurance companies, we're expected to be a therapist, a psychiatrist, a nutritionist, which is nuts. Really, we know that the best care, and by the way, the better care is for it to have nothing to do with the clinic or the hospital setting. It's actually outside of that. But in whatever setting, to have a multidisciplinary approach, so that whether it's in the schools and teaching about proper nutrition and exercise that is practical, as you say, so that it's not prescriptive, that kids can know, okay, well, I love to dance. That's the thing that I'm going to do. And you've already alluded to some of the barriers for certain people based on their age, but also, based on their income. And, Dr. Lodhi mentioned safety and so forth, but also their likes, what people prefer, what people like, and that should really be honored. And you've mentioned COVID. So let's talk about COVID. Is the whole COVID-19 pound weight gain real, or is that something that is, because, Dr. Lodhi, you spoke about weight loss for seniors. I'd like to hear from each of you what your experience has been thus far.
That was a good call for me. Well, for me, I think it's more of just the depression, right? So I think it doesn't fall within anything more than people are depressed. There's no outlook for anything that's going to bring them closer to what they think would be normal. I think because we're not used to change and we fight change as much as we can, that's what COVID has brought forth to most. So the weight gain comes from how often can you watch Netflix, or, how long do you want to really move corn around or, salt around. It just becomes a realistic place of you can get away with that for 3-4 months. We're into a year of trying to recreate something that keeps you not only healthy, but away from all of what we are. I mean, we're a relational body of people. Society as a whole, we're relational. So there's absolutely no way to think that that would not play a role. I mean, right when we think, okay, end of the year, we can at least fellowship now. We haven't seen you all year. We've done enough, right? We're coming together. It becomes, once again, something that has to be, especially in California, we are completely out of realm of doing anything. So I think it's not COVID. It's almost as if I feel like everyone's just putting a blanket statement out by saying COVID and not understanding that there's all of these things that were happening prior, and COVID just brings it to the forefront because now you can't really get around how you're feeling. What would you say, Dr. Lodhi? That's what I would.
Percita, I completely agree with you. That just bringing our spirits down, COVID has affected everybody. But the weight issue that I was alluding to with Dr. Albayumi was, in long-term care settings, in assisted livings, in even in independent living senior kind of facilities, I am seeing more weight loss because patients they enjoyed being together in a setting where there were their friends, neighbors, and they were eating together. And
right.
now when they don't have that, then I am seeing more weight loss in the community living patients who are, were living in independent homes, or they are, even when family is visiting, they're still by themselves. Yes, weight gain I've seen because they are not as active as they used to be. They are not visited by their grandchildren or other family members, not going grocery shoppings and activities on a daily basis that they were. Yes, I have seen some weight gain, but more I've seen weight loss. And I agree it's because of, probably, more being depressed, not probably, but depressed and anxious and just worried about an uncertain future. That's what it was. And for so many, we have this continuing care retirement facility that we go to. And so many of my patients who are in independent living, but they feel isolated. They've told me, no matter what, I could go out there and get COVID and die. I don't care. Just let me go and have my meals in the dining hall to be around friends.
Wow.
It's very sad. Yeah,
Yes,
but that's what it is.
And the funny thing about what you just said is I've not only heard that, but I've heard that the food is nasty. What cracked me up about that statement is it's the same food, but I realized they had other options, right? So it was not so bad if you can kind of sneak in a burger here, a sundae here. Even my mother, I set it up for her and she's like, girl, it's salty. And I'm like, it was the same meal you've been eating.
Well, that's
so. I wonder if that also has a play
Oh, I'm sure it does. I want to just take some questions from the that have come through the chat. One of them, I think you've already addressed, came from Ms. Jerry Feaster about walking in your home for 30 minutes in small increments. That was already answered. But there was another question about sort of snacks and what are some of the alternatives available to sugary or salty snacks? And I'll just share another true confession. I find that when I start snacking on carbohydrates that are really sweet, I will feel like I need to eat more and more. Whereas if I choose something that's more protein heavy, even if there's some like maybe nuts and raisins or something, although obviously not so many nuts, it doesn't feel like I'm going to be out of control. Is that true?
I'm gonna let the doctor. I watched your slides, doctor, so I know how you.
Oh, yeah, we forgot, Dr. Lodhi. Please,
but I think it's on the website. I saw it on the website.
let's.
I hope you went to the website. Yes, I really want to share that website because I refer all my patients to that website.
Please, let's go. Let's do it. Please share your screen. Thanks for reminding me, Ms. Percita. I totally forgot.
Let me share my screen, but while I'm doing that, the other thing that I want to say about your question was, and that I don't have in my slides, was what about the non-sugar sweeteners and other alternatives? So the research on them is not definitive, about their long-term effects, but in the short term, they're considered to be better alternatives than, especially, sweetened beverages and that just give you a whole lot of calories in sugars and not giving a whole lot of nutrition. So the website that I was referring to is choosemyplate.gov that I really refer my patients to. And I want to stress what Ms. Percita was talking about earlier. Healthy eating is about what works for you and for your life. What's your quality of life, what you can get to easily, we're all, for younger or older patients, we all have our lifestyles and the way we work and the way we exercise and all that. So it's not about how many is what my diet should be. It's about portion size, and it's about what's on your plate. So as a rule, half of your plate should be fruits and vegetables, and the other half should be grains and proteins. And when we are talking about grains, try to choose grains, whole grains, bread. If you're choosing bread, try to choose the one that has more whole grains and fiber in it than anything else. And then make dairy a part of your meal. So this is the picture I send all my patients home with. And then whenever you can replace your fluids, replace them with water instead of beverages with a whole lot of sweeteners in them. So your Diet Coke even, or your sodas and your juices, replace them with water as much as you can. Okay. And then I would refer you, I really like this quote. We want to change the world because we think we are clever. But as we become wiser, we change the ways we operate. I really like this quote from Rumi. And this is some of the choices, some of the ideas that you can choose out of when you're choosing your plate. I wanted to put this table up here, but if you go to the website, you will see a lot of options about what your protein might look like. My recommendation again would be to keep changing. Change the proteins you eat, change the grains you eat, change the vegetables you eat, or for different meals of the day and different times. Again, we all have our limitations now with COVID, grocery shoppings, fresh food availability, food that is delivered to our houses. So again, taken with a grain of salt.
Mm-hmm. Well, of course, when we're talking about health equity, at the Rodham Institute, if we step back, and I always like to tell the story of Berry Farm, which is in Ward 8, because it used to be a farming community, and that food was actually grown in the community. And if you talk to some of the older residents, they say that they would pick off apples off of the tree and eat it themselves. So it's ironic that these have now become food deserts. So if we were looking at really making the health of our communities better, we would look at before people got sick, looking at the community itself, looking at, is it walkable? Are there places where there can be, farming either on a rooftop if you live in a building, or a community garden or whatever? And I'm happy to tell you that there are lots of initiatives in the community that have done that. There's oh gosh, I can't remember the name of the organization. It's under one of the big bridges, which folks have taken over that whole area and are actually growing their own food, which is, I think, it is important. So there has to be, sort of a holistic lens. However, as an individual during this time, there are a lot of challenges. And I just want to make a shout out to a couple of great organizations, because we talked about the quality of food that's available to seniors. Food and Friends has free meal delivery that is made on site by a chef. I've eaten the food and it's fantastic. They've got 10 different menus depending on what your preferences are and what conditions you might have. So if you have kidney disease and you're vegan, there's a special menu for that. They also have the option of delivering, let's say that, no, I just need the actual produce to be brought to me and the dry goods. I can cook at home, it's just getting it. Well, then that's something that they can do. And what's great about them is not only do they give that to the individual, and the qualifying diagnoses are HIV, cancer, diabetes, things like neurologic diseases, but they also supply the food for the family. And it's not income-based. So for the 10% of seniors on the richer part of town that are having food insecurity with some of these chronic medical conditions, they deliver there. But you do have to have a referral from a clinician to do that. But that's a great organization because, yeah, quality of food and how good it tastes is very important. I see that there is a question that's coming up, and maybe this will be our wrap-up question or comment. This says, this is from Mr. Felton. When I drink more water before I eat, I tend to eat less. My question is, am I removing extra enzymes from the stomach that help break the food that I just ate?
No.
Okay.
I mean, people typically eat, or I should say drink water before they eat because they're trying to keep their stomach flat. And I'm just saying that as a consumer and as a fitness professional, you don't really find a lot of people that are doing it for any other reason. Meaning, even when you would go out to a restaurant, you're not necessarily asking for water before you eat. I don't believe, and you can help me, doctor, if I'm wrong, and scientifically it is the truth. I would say you're filling your stomach up with water so that there's not a lot of place for your food to go. I can't quite see water breaking down enzymes. Again, that just doesn't work. One's chemical, one is not. So the chemical reaction wouldn't play out the same. I would suggest which is kind of what you talked about, when you eat protein instead of carbs more extensively, because it takes longer for the protein to break down, and it's not sugar-based, meaning it's not going to spike you. It literally makes you feel fuller. So what's on my plate, the only thing different in my plate is that I don't eat dairy, because dairy just doesn't like me back. I love dairy, but dairy does not like me. But I am a protein veg equal person, and that works for my body. Right. Mm-hmm. So I'm not saying that as a whole. Listen to me, people. I'm saying that is what works for me, because I am muscle driven, meaning most of my workout is resistance. So I need my muscles to stay strong. I need the bone density to stay strong. So for Mr. Felton, I would say you're actually eliminating what you need. When you heard the doctor say, drink the water that you're replacing, she's not telling you to drink water in excess of missing the food. You actually need the food, and you want to drink the water to marry up with what you know you're consuming. If you're eating leafy vegetables, then you're eating water, and that's a beautiful thing. But you also want to understand that you want to hydrate the body even when you're eating the things you're not supposed to eat or drink, right? So that's the way I would say, eat more, eat and then drink. Take 20 minutes before you actually drink your consumption of water. I'm hoping eat first and then wait the 20 minutes so that you can actually be better.
Well, believe it or not, our time is come to a close. I think that we'll have to have you back because obviously there's so much more to talk about.
Well,
But
I
in
have to come to
close,
DC because you guys are fantastic. I'm like, or you need to come here. We need to figure that part out.
yes, for sure. When we can, we will come and visit you, and we will show you around here when you can come and visit us. I know that this is a challenging time for many of us, but I just want to say I am personally grateful for so many things, despite the difficulties of this year. And one of the things that I'm grateful for is the Rodham Institute staff, Ms. Ashanti Carter, that produces these webinars, Ms. Christina Williams, who's actually in the process of having hot meals delivered, Ms. Tracy Bass, who's just started the Doctors of Tomorrow program for 10th graders. I'd invite people to visit our website and take a look at our DC Reimagined video donation pitch. But I want to, of course, first and foremost, thank Ms. Percita Moore for joining us and sharing her knowledge and expertise and wisdom. And Dr. Lodhi, as always, we appreciate your insights, and we value everybody in our community, old, young, disabled, people who have challenges in mental health, returning citizens, LGBTQ, undocumented, of course, people of color. We are all we're all human beings, and if we're lucky enough, we'll all become old. So thank you so much for your time. And I wish everybody a happy Hanukkah, a Merry Christmas. I don't think Eid is coming up, a Happy New Year, but I hope that 2021 will be safer and healthier for all of us. And thank you so much.
Thank
Good
you.
night.
Happy holidays,
Happy
everyone.
holidays.
Good night. Bye-bye.
Bye.